Hello and welcome to The Balance. I'm your host, Andreana Jackson. I'm a realtor with over a decade of experience in the Miami real estate market. And today on The Balance, we are discussing men's health. And to discuss that conversation with us, I have the Chief Global Medical Officer.
It's funny that my team actually makes that joke all the time because they're like, so are you the chief medical officer? Are you the medical director? Are you the global chief medical officer? Intergalactic? What?
Dr. Haleem Mohammed. Welcome,
So yeah,
Dr. Hal.
I am the chief medical officer of Gameday Men's Health, which is the largest men's performance clinic in the world.
You have like 418 clinics, right?
As of Saturday morning, I think, that was 418 on last count.
Wow. So you operate in the United States and Canada?
Yes, we are in 48 states. So it's a franchise model. It was actually developed by a good buddy of mine, Dr. Arvin Miller, back in 2018. He's a PhD, and it's not a marketing story. It really is a personal growth story, because what he found was he had just exited another company that he built, and he was in Hawaii, and he was looking to improve himself. He knew something was wrong, something was off, but all the options that he would go to would be some of these, just, I don't want to call them seedy, but like not great places for hormonal health. Or it was like places like med spas that didn't really understand the nuances of it, or online options where you're never going to see the same clinician again. Or the traditional doctor's office, which really doesn't manage a lot of the performance stuff, a lot of the optimization. And he decided he was just going to build his own. And that's where Gameday was born.
So it's a men's performance spa?
It's a men's performance clinic. It's a medical clinic.
Okay.
And we deal with mostly erectile function. I don't like to call it dysfunction, because 52% of guys are going to have erectile dysfunction at some point in their lives.
Okay.
Hormone replacement therapy. Weight loss. We're into peptides now, which is the hot thing, right?
Talk to me about that in a few.
Sure.
Okay.
And then a lot of the longevity lab panels, and we're starting to layer in diagnostics as well into that.
Amazing. So men's health, that whole landscape is changing. More men are becoming proactive about their health, their performance, and longevity. So I think that's really interesting that you guys are stepping into that market fast.
Yeah. I mean, we have sort of realized that traditional medicine is great at sick care, right? It's great. Like when you're 65 years old and you have that heart attack, the American medical system is incredible with that. We can save so many lives. We have saved so many lives. We have incredible research out there. But what about that guy who's 30 years old, who's now, has a hemoglobin A1C that's starting to tick up, or his, cholesterol numbers are in line, but they're slowly elevating, or the 40-year-old guy with testosterone levels of 300, which are considered normal, but the range goes from 300 to 1200. So if you're on the bottom end of normal and you go to your, traditional primary care doctor's office, they'll say, "You're okay. I'll see you next year." And it's not to any fault of their own. It's a system that we've developed that, they see the patient for 7 minutes and then have to write a note for half an hour to appease the insurance gods.
Yes. So talk to me kind of about your model, a patient coming to you.
Sure. So we've removed all the friction from traditional healthcare. You come in, you're going to have 45 minutes to an hour visit. So we can actually sit down and discuss optimization rather than just sick care. The appointments are usually same day or next day. So you're not waiting, in the state of Florida, the great state of Florida, we have anywhere from 30 to 60 day wait periods to see a doctor. Yeah. And that's unfortunate, but it's the system that doctors are dealing with. So we've removed insurance from the equation. So it's, it's just the clinician and the patient.
Okay.
You'll have labs drawn the same day. Results the same day, because we actually have a complex lab within each one of our clinics, and we're able to do that because we have a medical director for each one of our clinics as well.
Nice.
And then you'll meet with a board certified clinician who's been trained in hormonal health and gets consistent, continuing medical education that we do on a weekly, monthly basis as well. And it's not just myself, it's all men's health experts, urologists that are presenting to them, endocrinologists that are presenting to them. And then within our own clinic network, we have 20 medical advisory board members that are actually 17 medical advisory board members that were hand selected by myself and Evan. All board certified, practicing within the system. So it's not There's no figureheads within Gameday. I see patients every Monday in Weston in our Weston Gameday clinic, and I cover whenever the Aventura or Boca locations need help.
Okay.
And I expect that from all of my medical directors and my clinic directors in the medical advisory board, that they're actively seeing patients within the system. So I think that's a big difference between what you might find in other places where, a medical director is just there for show. So,
Right.
yeah,
You're active.
yeah.
So you're in it.
Hmm.
Talk to me about the keyword now, especially Miami, wellness, and then the new one's longevity.
Yes.
And your actual, what is it? My actual age is,
Your biological age
yes.
versus right.
Yes, thank
By
you.
the way, none of those biological age clocks are really accurate, because they're measuring so many different things, and you'll get, I've seen reports where some of the considered best ones will measure an age, and it'll be 3 different ages within the same day. So
Right.
depending on what your status is. I get it. Longevity is a popular buzzword now, but really longevity is just preventative care, right? It's talking about what do you do in your 30s, 40s, and 50s so that your 60s, 70s, and 80s have quality years, rather than just getting sicker and sicker. So it's getting ahead of these things and making sure that we're not necessarily treating them, but we're optimizing you so that your later years are optimized, right?
Right.
And it's going to be with the 6 pillars of health, and it's boring stuff, but it gets back to diet, exercise, sleep patterns, stress levels, reducing harm, and then social interaction. And then you can look at all the other interventions that we have, whether it's peptides or hormone replacement therapy or erectile dysfunction treatments. We layer that in as well, but I always expect my clinicians to talk to the patient about those big things that we can do.
What about for overweight men?
So hormone replacement therapy works great. It takes a while to start working to get that body recomposition. But there are plenty of tools now that are available to help lose weight quicker.
Okay.
Low testosterone is actually driven by adipose tissue, fatty tissue. So the heavier you are, the lower your testosterone is probably going to be. And then because you're heavier, you're going to have low testosterone. It's sort of a vicious cycle that we're trying to break.
Okay.
I myself 3 years ago I was 255 pounds.
Really?
Yeah. And sort of stuck on that, trying to work out, trying to eat right, and reduce sugar and all the bad things that you're not supposed to do, and it was hard to lose weight. I had to optimize my hormones and add on weight loss medications with it, and then eventually taught myself how to eat again, making sure that you look at your plate. And I tell patients, like, I'm not a nutritionist or a dietitian. We have plenty of dietitians that we can refer to, but I look at a plate of food and I'm like, half of that should be protein. That's how real basic, and then a quarter of that should be something with a vegetable, right? So a green something, and then the other quarter I look at and say, that's where my complex carbs are going to go into. Real easy way to sort of sort out your plate.
And it's a mental shift from where from how you described it. Like, I need that, and that, and that's how I'm going to feed myself, and be satisfied with that as well.
Look at food like fuel, and
Yes.
and us as physicians, we look at it as a reward center. So all through residency, I was eating like crap, and that's how I ended up gaining the weight. And then in a high stress corporate job before this, and now I'm very deliberate about how I feed myself and fuel myself, and it's really it's a mindset change that you have to make. Hormone replacement therapy actually help with that, because they, believe it or not, there's areas of your brain that are affected with low testosterone. Decision-making capability, executive function, those are all directly affected by low testosterone. So it may not be their fault. It may just be their hormones are not balanced. And I think once I got that sorted out with myself, I'm able to make better decisions and look at decisions and the downstream effects of those decisions. And it's a big change.
You're calmer too, right?
100%. Yeah. So that's a misconception, right? Where people say, well, roid rage. What happens is when you have low testosterone, you can also have mood swings, sleep disturbances, irritability, and then when you have supratherapeutic levels of testosterone way too high, you'll have those same symptoms as well. But when you're in a therapeutic range, things should normalize. you know.
I wanted to talk to you about older men. Let's talk about men like in their late 60s, 70s.
Mm-hmm.
That's a whole new population of men living a lot longer. Does hormone, like I guess I want to say low testosterone, will that affect them as well as you
Absolutely.
age?
So there is, there's age-related hypogonadism, low testosterone, and then there's all the metabolic factors that happen. So if you've got this 60-year-old, 65-year-old that's overweight, that's been, eating junk his entire life, that hasn't been working out, that smokes, maybe drinks, excessively, that's someone that we can still help by sort of sorting out all of those things that are causing their low testosterone. But a lot of times they do need hormone replacement as well. Your testosterone starts declining at age 30, about 1% a year, starts to accelerate at age 40. And then what I'm noticing in the literature is that there's a 20 to 30% increase in the decline over the last 2 to 3 decades. And it's because of our lifestyle.
The food.
Yeah.
Okay.
Food is huge.
Amazing. Talk to me a little bit about your background.
Because
I noticed you have an MBA as well.
Yeah. Born in India, raised in Brooklyn. So I'm a poor Indian kid from Brooklyn in my head. I'm always going to be. My first career was in finance. I was a stockbroker, made it up to VP of investments. That was back in 2005. Mom and dad said, that's enough. Go be a doctor like a good Indian boy. So
they weren't impressed.
No. In my family, I think mom and dad, between the two of them, they have half a dozen degrees. So we're just trying to catch up.
Oh, wow. Amazing.
Yeah. So I went to med school, did my residency in internal medicine. So I'm board certified in internal medicine.
Okay.
I was at Advocate Masonic in Chicago, the top 100 hospital. Had fun there. I was voted class rep and then resident of the year by my peers. And then, started and ran a hospitalist group outside of Springfield, Illinois for a couple of years, practicing rural medicine with the closest specialist 30 miles away. So I had a helicopter to get, my patients to, if they needed a cardiologist or a nephrologist emergently. Otherwise, I was managing them there. Me, the emergency room doctor, and our incredible nursing staff at ALMH. And then after that, I came down to Miami. My wife is also an internist. We both were with Leon Medical Centers, which was an incredible experience. We were with them for 4 years. She ended up becoming their physician advisor as well, helping roll out Epic and all that. I started as their regional medical director, ended up being chief medical officer on the provider side, managing about anywhere from 500 to 750 clinicians across Miami-Dade County. They have 8 mega medical centers. It's considered one of those American medical home runs.
Right.
They have a really good system. Still talk to the family. We're on very good terms. But I wanted to sort of start my own clinics, and I wanted to get my health in order.
Right.
My wife said to me, "This is great. You're a great provider. We have great jobs. We have an amazing life in Miami. I want to have a baby. And are you going to be around if we have this baby? Because you have hypertension, borderline diabetes, cholesterol through the roof. You're a walking heart attack 10 years from now." So I got it together. I lost 70 pounds, normalized everything, started opening my own clinics. We had our baby 10 days before I opened my first clinic. So everyone was like, you're crazy. You're going to open a clinic while, having this brand new baby and a wife at home. But it worked out. God is good and helped guide us. And we've had an incredible team around us. The Gameday corporate called us about 6 months in and said, I love what you guys are doing down here in South Florida. We were the first franchise to open in Weston on the East Coast. And then Boca and then Aventura. And they asked us to become training facilities for the nation because of how we were practicing and performing. So we ended up training to about 200 clinics through our 2 clinics that were open at the time. And then last year, Evan calls me up in February and says, "Hey, you're taking over as chief medical officer." And I said, "Well, take me to dinner first." so
treat me.
Yeah. But I mean, we both have the same mindset. We're in lockstep all the time. His vision is something that I admire. And it's funny. I've got 10 different ideas that I want to do. And he'll tell me, "Hold on, Hal, let's sort out like what we're doing already." And listening to that sort of guiding guiding voice really has helped. And then I get to be his trusted advisor, consigliere.
Right.
So it's a lot
Little
of fun.
Godfather.
Yeah. We have a lot of fun at at the corporate level. We've got a great team that we've put together, constantly adding because as we're growing. I don't know if you saw recently, we're slated to be, we're actually the fastest growing health franchise in the world, and slated to be, we are the largest men's performance clinic in the world, concierge clinic in the world.
Well, when you look at it, no one's really doing what you're doing targeted at men.
I think it's unfortunate because these are the guys that need us the most, right? The 40 to 60-year-old, high powered executives, blue collar guys, doctors, lawyers, and we have the entire thing, but it's that age group that I think was sort of forgotten. And then 75% of those guys don't go to the doctor. There's too much friction. There's too much going on. There's too much, they've got to take care of their wife and kids at home and job stressful and all that.
Or just the mentality that men, I can take care of it.
Stoic guys, right? So,
right.
I mean, think about our dads. They didn't talk about this stuff, right? There's a stigma around it. And now everyone's comfortable talking about hormone replacement therapy and erectile function and bringing it out there, normalizing it, and taking the stigma out of it, and educating and making sure that they're going to the right places. That's my biggest thing, right? I always say, I don't care if you come to game day. I don't care if you come to my game day or another game day. I just want you to go to a medical office. I understand the need for med spas. Absolutely, they're aesthetic places. They do a spectacular job. My wife goes there for whatever she needs. Manicure, pedicure, Botox, fillers. All those things are absolutely
You're just
needed.
Her secrets?
Right? Yeah, not her specifically, but I'm saying like our wives go there, right? And I know plenty of guys who use med spas as well.
Right.
But when you're talking about hormone replacement therapy, when you're talking about erectile dysfunction, these are medical treatments. These are things that you should be doing at a doctor's office,
right?
With clinical oversight. And we're fortunate to have, like I said, that stable of just specialists and men's health experts across the country. We don't operate in a vacuum. We advise on at the highest level. Can't say much more about that.
Okay. Okay. Talk to me then about peptides. That's the new buzzword.
I mean, you saw RFK the other day on Joe Rogan saying that 14 out of the 19 peptides are about to be available for public consumption.
Amazing.
Yeah, I mean, I think it's amazing tool. There are amazing tools, but remember, insulin's a peptide. Yeah, those weight loss medications.
Talk to us really quick what a peptide is.
It's just a short chain of amino acids that put together, and that's what we call them, peptides, because the bond between those amino acids is a peptide bond.
Okay.
Yeah, so peptides is not a new thing. It's just when I hear it being repeated by health influencers and fitness bros, I'm like, okay.
Okay. And so then why is it now everybody's on it?
Because tirzepatide, semaglutide, those are peptides. Okay. The weight loss medications that everyone's taking.
The GLP ones?
Right? The GLP ones, those are actually peptides.
Okay.
Insulin's a peptide that's been around since 1918, I think. The newer peptides that people are talking about, something like tesamorelin, what else? PT141, that's for sexual health. Tesamorelin is more for visceral fat loss. Those are actually FDA approved. Those are FDA approved for specific indications, and you're able to use them off label if your patient meets the appropriate criteria. And then there's another 1,500 peptides that you can take a look at. Okay. But I always tell clinicians, try to get really good at what you do, but you limit your scope, right? We can't be everything for everyone. Right?
Okay.
Yeah.
I love that. Yeah. I love that. What does longevity mean to you?
They asked me this question this weekend at the Clinical Application of Longevity Medicine conference. And, everyone said, living your best life as long as you possibly can. And my thing was, what's my purpose? My purpose is to be the best possible husband I can be to my wife, make sure that she's always happy with me. And then be the best possible dad to my son. That, longevity to me is, I want to live forever so that I can be around for my family. That's my purpose in life, and take care of my patients as best as I can. So
amazing. Is there anything else you want to tell us about Gameday?
We're just we're expanding. We continue to expand. We're the only brick and mortar location that's expanded like this. We're the safe option. We're always going to be the safe option. There's a lot of eyes that make sure that we're doing the right thing by patients every single time. Evan Miller's mantra has always been, take care of the patient first and the success will come. And lo and behold, the success came. Within our best performing clinics, 8 out of the top 20 are operated by members of the medical advisory board. 9 out of
that's a big deal.
That's a huge deal. So we have 17 members on the medical advisory board. 9 are operating the top 20 out of the top 20. So you're talking about more than 50%, right? That's an incredible stat. What does that tell you? That tells you that the clinical oversight matters. Clinical governance matters. Doing things the right way by patients matter. We as clinicians, we look at things a different way. It's not a business for us. It's a vocation. It's something that I get up every morning excited to take care of patients. And then success just happens to follow because of that.
It feels like it's a movement.
Yeah, it really is. It really is.
It really does. Yeah. I'm impressed just because, I have a father who doesn't always tell me what's going on. And but he's better now. And thank you, Dad. And but I just saw the need for something. I see the need for something like this. And I want to thank you guys for what you're doing for the community, because our men don't like to tell us what's going on, and we want them around.
They tell us in the consult rooms all over America and Gameday. And our responsibility is to make sure that they're better dads, better husbands, and better members of society. So thank you for allowing us the honor to take care of patients. So.
Amen. What do you see? How do you see the future?
It's incredible. I wake up every day excited again to go to work. I'm realizing that there's an awakening across America of guys who are like, I'm not going to feel like this. This is not who I am. And they're taking a hold of their health, and we're helping them, guide it. We're getting in a lot more educated patients, guys who come in and I discuss studies with, guys who bring in, who'll text me different things that they're taking a look at and want a clinical eye. So that's really cool to see that awakening across America.
Amazing. Do you see other locations expanding within Florida?
Yes. So I think we're at 30 clinics in Florida so far. Yeah. And we should be expanding to another 50 at least, I think, by the end of 2027.
So are you like in Central Florida, West Florida?
I'm only in my own personal clinics are in South Florida.
Okay. That's
because I like to be able to go and see my patients.
Right. Right. You're staying here.
Yeah. I try to keep it within an hour drive.
Okay.
And
that makes sense.
Yeah. So, because I've got to be at school at 9 a.m. and 3 p.m. Right. So everything has to sort of coincide there.
I love that you drop your son off, you pick him up. You're not relying on anybody else to do it. So
it's my time. It's my time with him. And, we sing Wheels on the Bus on the way there, and, we do numbers and alphabet on the way back. Seeing his face as soon as I walk in that door when I pick him up, there's no amount of money that can replace that.
And that's why you do this.
Yeah.
Well, Dr. Howe, thank you for taking time out of your schedule to stop by and to be on The Balance. And I wish you more success in the future.
Thank you so much. This has been awesome.
Thank you, sir. And thank you. Goodbye.